Hi, welcome to part 4 of reviewing candidate feedback from the Osce. Hi, my name is Chanto. If today is your first time seeing our videos, make sure you follow us, like, and then share as well to those who are preparing for their Osce. You see this feedback app here, it talks about unclamping the catheter setup right after your scale station called catheter specimen of urine, CSU. So CSU is 8 minutes clinical station in Osce for both nurses and nurse associates, where you are required to collect urine from your patient catheter. And as part of the items you will pick, you will need a non-traumatic clamp that you're supposed to use it to clamp the catheter setup before you collect the urine. In the exams, most of the centers place the catheter, there already. So you may meet the catheter setup being what? Clamp by the non-traumatic clamp. And the marking criteria says you should clamp it few centimeters distal to the sampling pot. You are required to clamp it yourself as a candidate during your test. However, when you meet a clamp there already, I always advise candidates to also pick their own clamp and then clamp again, okay? That is before the main clamp. However, at some centers, before you start, even in your course of the test, the assessor may tell you that consider the clamp you see, is your clamp. So assume you have clamp your catheter setup already. So there's no need to clamp again. But if they don't give you this prior notice, then you are required to clamp the catheter setup. Anyways, this is not why I'm making this video. The main motive behind this video is after collecting your urine from the patient catheter setup, you are required to unclamp this catheter. And that is the major concern here. Many candidates forget to unclamp this catheter after their procedure, and this does not amount to patient safety because clamping the catheter will cause pain in the urethra and then patient bladder. That will make patient uncomfortable, and that is not safe practice. So therefore, it will render your station a fail. So make sure after the procedure you unclamp. Many candidates forget to unclamp, one, because they forget, all right, and sometimes it's because they meet an already clamp placed over there. So after the procedure, they forget to unclamp it. If you meet a clamp there and the assessor says, assume that is your clamp. After your procedure, this is what you are supposed to do. Tell the assessor that you would unclamp the patient catheter setup and then dispose it. Verbalize it without touching it because you met it over there and the assessor told you that assume that is your clamp. After the procedure, don't forget to verbalize you would unclamp. If you forget to verbalize you would unclamp, you will be in trouble at the end of the day. That is why I always say if you meet a clamp there and the assessor do not tell you that assume it is your clamp, you to do your clamping so that when you are done, you will not forget to unclamp the clamp you place over there to be on the safer side. On the other hand, if the assessor tells you that assume that is your clamp, don't forget to verbalize that you would unclamp the catheter after the procedure. If this video helped you, please don't forget to share to others so that they can join us. If you want more videos on Osce and the feedback to prepare yourself adequately, follow this page, like and share. My name is Gentle. Thank you.